a life spent on Zoom?
Well, I'd rather not. But how will the world look after the pandemic? Hello and welcome to the show. I'm Stephen Beardsley in Berlin. That was sociologist Richard Sinnott, with whom we spoke on Monday as part of our week-long exercise of imagining life after the pandemic. That is, the aspects of society or even our daily lives that could be changed for the better. And we've been asking researchers from around the world for their biggest lessons from the past year and a half. Here's what we've heard so far.
Has the pandemic changed how we live? Will social distancing become the new norm?
The danger in this is that you naturalize the extreme, that you take Zoom or even working from home in isolation full-time as a norm. Can't do that.
COVID-19 showed our society isn't as shock-proof as some believed. A bitter pill, especially for the Western world.
Some lessons we can learn, obviously. One is that it pays to build in a bit of slack in the system, more resilience. And also, we shouldn't depend so much on supply chains for manufacturing. So I think we've learned that it's more important to have resilience than maximum efficiency.
What we see is that most countries also have they have food stocks for only a few days. You're very much dependent on other countries. Once the borders close, that really poses a problem to stock supermarkets.
What has the crisis taught us for future planning?
We have learned the lesson that if you spend $1 in advance to avert a crisis, you will save millions of dollars if the crisis hits.
The experience of the pandemic has accentuated the effects of inequalities, which many of us think are far too great anyway, and I hope there'll be pressure to reduce them.
What can the pandemic teach us about climate change?
Climate change does not have a vaccine. Whether it is Pfizer or Moderna or AstraZeneca or whatever, they're not going to come up with a vaccine or a pill that you're going to pop in and climate change will be solved. I hope that the right message is that we have to live in coexistence with nature, that nature is a huge thing.
All right, researchers there we've heard from over the past week, and we're not done yet. Today we're exploring a final question. What has the pandemic taught us about sustainable growth? Earlier, I spoke with Sandrine Dixson-Decléve. She's co-president of the Club of Rome. That's an organization that for decades has warned about the perils of economic growth at all costs. I asked Sandrine if the race to grow economies in the years ahead would come at the cost of sustainability. Take a listen.
Well, I'm hopeful not, but I do think that we are starting to see that in some of the reform and recovery plans, that the money that was supposed to be allocated to more green and social initiatives is not necessarily going in the direction that we had hoped. We are actually in the process, and myself involved in a series of different conversations with European member states to try to convince them to definitely allocate that money into programs that will create the resilience that we need to face future crises. So I would say that, unfortunately, short-termism within political cycles and also thinking only of an economic reboot, which is predominantly linked to certain industries, won't get us to where we need to go to build the resilience that we actually need across Europe and across the globe.
I get the sense from talking to people, and personally for myself as well, that everyone's looking for a sense of normality when this pandemic is over. A core principle, if not the core founding principle of the Club of Rome, has been that growth as normal is not sustainable. Is this pandemic a chance for politicians to signal a new direction, or is it the wrong time to signal that, given that the public maybe feels like it's already sacrificed a lot?
I think the pandemic is absolutely the right time to demonstrate to people and tap into their consciousness. They themselves have lived through this pandemic and understood what is most essential: their lives, their livelihoods, access to food, access to clean water, access to public spaces where they could actually go and feel revitalized, so nature and forests, etc. But what we're seeing is that those people that are ready for that shift are not getting the signals actually from their governments. You're right, the governments are going back to business as usual. And, you know, there is that catch-all phrase for the moment that we need to build back better. But many of us are indicating, first of all, you can't build back glaciers. You can't build back some of the things that we've destroyed. For the last 50 years, the Club of Rome has indicated that actually we're not just going to have one crisis. It's not just going to be a pandemic or a climate change crisis. It's going to be a series of crises. And my deep worry is that short-termism within the public sphere is actually not allowing for leaders to seize this opportunity and work with citizens. We have seen that actually COVID has transformed communities. We should be building on that transformation to bounce forward differently, to grow differently, to bring in more equitable wealth distribution. People actually are ready to ensure and want to be ensured that they can have access to vaccines, access to good health care, access to the most important essentials in their lives. And even though there's been a bonanza online of people buying, I do think that if we get back, and in fact, citizens have said in countless surveys that they are ready to shift their lives, to take into consideration already the health pandemic, but also future crises.
You would say the politicians are the ones who aren't signaling right now that they're ready to push that further along. But aren't they hearing themselves from their citizens? Aren't their necks on the line, first of all? Isn't that always the great tension about that short term, what people want now, whether it's that trip to the Maldives, for example, whether it is the ability to buy whatever they want, whenever they want, versus their long-term fears? Can't they often have both at the same time?
So again, I'm not sure the politicians are listening really to people. I think they listen to what they want to listen to. They listen to special interests. We do know that corporations have a great deal of power in the way in which our politicians think, act, and also look at economic growth. Again, all of the surveys that are coming back are indicating that people understand that we are facing a series of different crises, and they do want to change. Change is difficult and it's complex. And if we don't have brave leadership that understands the complexity, that understands systems approaches in order to actually build the resilience that we need for future generations, then we aren't going to get there. So there needs to be an approach taken by leaders. And what's interesting is that when we look at those economies that truly have made the shift, so for the moment, we have 5 key economies that have actually moved to well-being economies that are looking at social, economic, and environmental indicators together, and they're moving beyond a GDP growth scenario. Those economies are Finland, Iceland, Wales, Scotland, and New Zealand. And all of those economies actually are very much shifting into this area. Now, what's really interesting for me is to see that actually through COVID, they're also the economies that have managed the pandemic the best because they've started to de-risk this dependency on only production. We have to remember that value chains and production has been totally disrupted by COVID. And it is those economies and those companies, by the way, that truly take into consideration what that disruption is going to do that are becoming much more resilient.
Sandrine Dixson-Decléve there, co-president of the Club of Rome. I spoke with her earlier. And we go now to our science correspondent, Derek Williams, who ends this week with his own vision for a post-pandemic future.
They say if you don't have your health, you don't have anything. What more can we do to keep as many people as possible, as healthy as possible?
This week is about visions for a post-COVID world. So I want to talk for a second about a fundamental change in perception that I personally view as long overdue. Now, a minimum standard of health for all is enshrined in several international agreements, including the 1948 Universal Declaration of Human Rights. But over 70 years later, this pandemic has once again focused a glaring spotlight on how very, very far away we still are from actually providing equitable medical care to everyone. At the same time, it's highlighted that none of us are safe until all of us are protected, even those who can't afford it. It's in everyone's best interest to provide comprehensive COVID care and vaccines to everyone. But the first question everyone asks is always, who's going to pay for it? And for me, that's the crux of this very fundamental problem. Health is still way too closely tied to making money. We've monetized medicine, and that needs to change. Don't get me wrong. There's no question that a model treating medicine as just another way to pursue profit, that it also helps drive innovation, whether it's at a pharmaceuticals giant or a doctor's practice or at the insurance companies that finance it all. But I personally don't think that we'll ever be able to provide decent health care to all as long as we continue to treat health care as a product, something to be bought and sold like a car or a smartphone. I believe we've reached a point in human history where high quality, universal medical care shouldn't be seen as a utopian dream, but as an achievable goal. Who knows? Maybe the pandemic will help push us in the right direction. And this week was about visions. So that's my hopeful wish for a post-COVID future.
All right, that's it for our team here and our week-long look at life after the pandemic. We thank you for joining us, and we hope to see you again soon.